Okay, so we discussed this before also, MS versus DNB. They are equivalent for all practical purposes, as per the recent most bulletin. DNB is equivalent to MD, especially. So, this is from the Gazette notification, the most recent, which spells out that those candidates who have undergone DNB training in an institute which now runs MCI recognized PG degree courses in a given subject, their DNB qualification shall be considered at par with the MCI recognized qualification in that subject. And those who have undergone DNB training in a multi-specialty teaching hospital with at least 500 beds. So if this is the place you're joining, then there is no difference at all. Okay. However, if it is less than that, then you have to add on 1 year as a senior resident to become equivalent to an MS. So it is almost, I would not say, if you're doing it from a 500 bed institute, multi-specialty, not a single center institute, then it is absolutely equivalent. But if it is lesser than that, then you have to work for an additional year as a senior resident to get that equivalence. But as I said, most students will prefer a MD or a MS seat compared to a DNB. But if you're getting DNB, don't be disheartened. It's, as I said, it's as good, if not equal. It's almost as good as an MS. And many places, there are so many institutes who have beautifully designed DNB programs, so you don't have a need to worry. Yes, DNB at certain places like corporate hospitals may be a little different, because now DNB seats are increasing drastically, and many corporate hospitals have DNB. The exposure might be lesser. Okay, and the practice is different, because in a corporate hospital there's a lot of the issue that comes there, and that is the patient is paying, and a patient who's paying, the responsibility of the doctor. I work in a corporate hospital, so I can easily tell you this, that the patient comes for me as a doctor. Okay, and as a primary consultant, so they would expect that I would be doing everything for them. So when my resident, I have to teach my so it's my responsibility to take care of the patient and to teach my resident also. So somewhere in the back, I mean, I do I would limit the amount of cases compared to if I was working in a teaching college or a institute. So that's the problem with DNB in a corporate hospital. Yes, the exposure would be little limited, but many places where DNB has been running for a long time in busy institutes, it is equivalent. So don't worry too much about that fact.